Giving birth can be very unpredictable, and if you're delivering in a military hospital, it can add another layer of unknowns. Maybe you've heard rumors about your local military hospital. Maybe you've read too many scary stories on the local military wives page or something, or you're just wondering if your birth plan is even going to matter. My name is Michelle Buller. This is the Waiting Warriors channel, where we talk about everything you need to know for military spouse life, how to get out of just survival mode and move into thriving. I've been a military wife for almost 13 years now. I have delivered 6 babies, half of those deliveries at military hospitals, the other at civilian hospitals, and I actually just delivered baby number 6. Where is she? Oh, she's over there playing, here on Oahu at Tricare Hospital. I'm sharing 7 things every military spouse must know so you can feel informed, educated, and empowered, and really ready to go to deliver at a military hospital. Okay, tip number 1, remember you still have a voice. Yes, a military hospital is built under the military rank, there is structure, there are protocols, there are policies, all that kind of stuff, but you still have a voice and rights as a patient. One of the biggest fears that I hear from other military spouses is that they are afraid that they will just have no say because they're delivering in a military hospital. And that is absolutely not true. You have so many patients' rights. You're allowed to ask questions. You're allowed to ask for time if a doctor recommends or suggest something as a step and plan forward. You're allowed to bring a birth plan. You're allowed to have the support around you that you need, whether that is extra guests or a doula, any of those kind of things. Yes, the doctors and nurses have a rank because they are in the military, but just like at a civilian hospital, they are well educated and have a ton of experience. We can respect all of that, but still trust your gut, and you still have a say on how your delivery goes. My biggest advice from just delivering, again, 3 months ago, it was an unmedicated birth this time, my first unmedicated birth. I would suggest that you remember the phrase, can we have an hour to think about this? This just lets you have a moment, take the power back, trust your gut, have a moment to think about everything that they just said and presented to you as an option, and then really decide what you want versus feeling the pressure of being in the moment, a doctor and nurse and all the kind of things. So remember that phrase. We're gonna take an hour to think about this, because you have the right to say that. The second important tip for delivering at a military hospital is you need to know your hospital. Even if you have delivered at a different military hospital before, they are all different, not only in their layout, but in their structure. They often have different policies, and with all those in place, the best thing to do is just educate yourself. Look into the tours. You can go in and ask questions. From my experience with military hospitals, it's typically there's a group of OGBYNs that do a lot of the prenatal visits, and then there's a group that rotates in the hospital. Again, that's different, but rarely is it you will see one person, and that is the person that shows up to your delivery. If you're going to ask questions about what delivery is going to be like, make sure you ask first, are you one of the doctors who rotates in deliveries? And if they're not, just wait until you do have one of those visits, or go down to labor and delivery and ask the nurses there yourself. Information really is your power. Now, with all that said, please remember that just because a hospital has a policy doesn't mean that it is law. That is just their standard procedure for things. So you can, still talk to your doctor about things and ask why that is their policy and ask for an exception to policy, or 2, don't interpret the policy to mean something that it doesn't. A case in point for this is a scenario that my friend had at a military hospital. Their policy was that deliveries happen in the bed, in the hospital bed, in the labor and delivery room. But that does not mean she had to be laying down on her back. She really wanted to do all 4s or try a different position and see what felt better and more natural to her, because she was not going to be having an epidural. And so while she couldn't just do standing on the floor, even though the policy was on the bed, she still was able to do different positions on the bed and still get what she wants. So even though they have a policy, that doesn't mean she had to be laying back down in a position that has felt uncomfortable for her, if that makes sense. Number 3 is military staff is typically very professional and compassionate. I know one of the biggest worries and often the loudest complaints is that there is a lack of compassion or just super strict protocols that different people were forced into. And I just would like to offer, as both my experience and the stories that I have heard, those are really just the loud minority. We have experienced what I would call bad bedside manner, but that was the minority. Again, I've delivered 6 babies, and that particular one was during a stillborn, which I know is a unique situation that I think sometimes the staff aren't prepared for or trained for. But regardless, most of the time it has been very compassionate, very professional, especially the L&D nurses. Now, with that being said, if you do experience at any point during your visits or while you are in the hospital, a nurse or even the doctor, somebody who comes to give you like a shot, or the phlebotomist or the anesthesiologist, or anybody who is making you feel uncomfortable, who you do not feel is supporting your birth plan, or you just are really do not feel safe or steady with them, you are allowed to ask for a new nurse, doctor, anything like that. Even in a military hospital, remember, you have patients' rights and they can accommodate that. Again, from our experience and the many friends that I have known that have delivered at military hospitals, overall the staff is incredibly compassionate. Just make sure you are communicating clearly what you want, and they always do their best to support you and provide that. Number 4 thing to know about delivering in a military hospital is that amenities might be basic, so you need to plan ahead. Again, case in point, I just delivered at Tripler here on Oahu, and there was no shampoo or conditioner in the shower. For some reason, I thought there would be soap. Other hospitals we delivered, even in a different military hospital, there were. I didn't bring soap or shampoo, so I had to make do. It's just the reality of the situation. It's a military hospital. It's not going to be how you see on Instagram. There's not going to be spa features or aromatherapy or any of those kind of things, but more often than not, you are allowed to bring any kind of comfort thing that you want to make your room as comfortable and peaceful as you would like it to be. Another example of this, again, even just difference between 2 military hospitals. When I delivered at Schofield, the pads that they had, because if this is your first delivery, just so you know, you're going to bleed quite a bit after the baby is born. The pads that they used were not like any kind of maxi pad I've ever used before. It was really like a rolled up liner. My understanding is because they have experienced people bleeding more and the pads not soaking it up. It was very uncomfortable for me. That would not have been my first choice. So I ended up having my husband bring me some different pads later on. So again, information is your power. So ask those kind of questions, and then you will be just all the more comfortable and prepared. Number 5 tip, don't forget about the free support programs that military hospitals offer. Universally, as of 2025, that's the year, the DoD at military hospitals has a new parent support program. Yeah, that's what it's called. Just check my computer. They also have parenting classes. The Tripler Hospital right now even has little like baby massage classes. Some offer at-home visits, lactation consultants. Some even offer baby gear rentals. It just depends on where you are and what branch you're at. But again, information is your power. Ask those questions on what is available and use them. Now, tip number 6 is going to be no surprise to any seasoned military spouse, and that is really the key to all military spouse life. It's to create a contingency plan. Military life is unpredictable. Military hospitals are going to be unpredictable. Guys, again, 6 deliveries, birth is unpredictable. So just be prepared for all the different things that can happen. Know what you want to do should any of the different things happen and things not go perfectly, so then you still can have the experience that you want to and you feel more settled and in control of. So some things to have a contingency plan for is whether your spouse is going to be there or not, who you want there in different situations, childcare, always have multiple plans for childcare. And then think of the different scenarios that can happen and what your response would be. I know no mother wants to think about the worst case scenario happen. Trust me, I very much so understand having lost our son. Also, believe me when I say that it will help you if you just have a plan for, okay, what if my water breaks and 24 hours happen? The policy for the hospital is that there's a C-section. Do you know what I mean? What do you want in those scenarios? And just decide that before, so then we're hoping for the best, but we're planned for all the different options. My number 7 tip is just remember that you're not alone. If you've been around the Waiting Warriors for a while, you know that is my most favorite theme, is that you do not have to do this alone. Again, most military hospitals, the L&D nurses are amazing resources for knowledge. There are those free resources, but also most have support groups, and then there is obviously the Waiting Warriors online community. I do have a podcast, and there is an interview I did years ago of a military spouse who gave birth while her spouse was deployed. So that is going to play next. It'll pop up somewhere around here that you can click on and watch next. But you don't have to do this alone. Reach out on the Waiting Warriors if you have any questions. We can ask the community, or you can comment below with what is your biggest concern, and I will do my best to answer them in a timely manner. Remember, guys, just because you're delivering in a military setting at a military hospital, that doesn't mean that it can't be a safe and comfortable and beautiful delivery. You just need to empower yourself, trust your gut, make sure you're surrounded by the support that you need. Even if you just talk to your spouse through things, talk to the staff there, they're very understanding. They know military life and they will do their best to help you through it. You guys are amazing. If this video was helpful for you, please like. You can subscribe. Next week, I will be sharing my birth story for my baby Lily. It was pretty eventful. Again, it was unmedicated for the first time after a loss. So it was a little bit of a unique situation, and there will be more videos to come to help you through military life. Talk to you later.